All new tonight in Virginia as Fairfax County works to cut down the rising number of young people who overdose in opioids. It has a new resource to help those struggling with substances.
That's right. We have our Max Marcilla joining us live here in the studio. And Max, this really sounds like a life-saving program.
It absolutely can be, and it all centers around this drug you see behind me. It's called Suboxone. It's a medicine that can be used to numb the cravings for fentanyl for those hoping to become and stay sober. Now, by the end of the summer, Fairfax County says it will have 5 locations for youth battling substance use disorder where they can get this medicine and more to help them, potentially even saving their lives.
I don't know, man. I just keep getting up.
Sobriety has been a constant battle for Denise Sharati. As we reported about a year ago, she's no stranger to telling her story and not shy to acknowledge why she's still here today.
It does combat the cravings. It helps with the cravings. It makes you sleepy. But like all medications, you just gotta get used to it. But it's definitely helps.
A combination of Suboxone, which she has used on and off for about 15 years, naloxone, which has saved her life, and talk therapy.
We need to protect our community against opioid use disorder.
That's been on Laverne Williams' mind constantly. She leads the Youth and Family Division of the Community Service Board in Fairfax County, which has seen a concerning trend.
We've seen a huge increase in opiate overdose in our youth.
The numbers back it up. In the Fairfax Health District, 12 times a minor survived an overdose in 2021. That happened 27 times in 2022 and a staggering 58 times last year. I walk in right now, I'm looking for treatment. Kind of what happens from here?
They're going to get a nursing evaluation. They're going to also meet with the psychiatrist, and depending on that evaluation, we'll go from there in terms of medication treatment.
This new facility, a place for walk-in free services paid for with some county money and some money from opioid-related settlements.
Everyone is committed as a system-wide team to decreasing the barriers to services and increasing access to care.
When you told me, I was ecstatic. I was like, what? It was pretty cool. It was really awesome.
A growing and faster response to combat a growing problem, taking too many lives, too many young lives.
One day we're going to get it right.
Now, any minor who lives in Fairfax County, you can just walk into the new facility at the Jerry Highland Government Center that's in South County, or the original one at the Sharon Bulova Center in Merrifield.
So, Max, how does the clinic expect to bring in new patients, and how many patients do they really hope to help?
Well, it's a relatively new program. It was a pilot program back in 2022, and they served about 35 people. Now they're expecting to serve at least 150. This resource, just part of a plan that overall seems to be working. Youth non-fatal overdoses, they are down from the last 2 years so far here in 2024. Now, the county is relying on anyone, family service workers, probation officers, family members, just anyone to help connect these kids with these resources. One thing Denise told us in our conversation earlier, she said it is so important to have that person you can rely on who can both keep you accountable and safe as you work through that substance use disorder.
Yeah, so much needed and doing really important work there. Max, thank you.